Understanding how to best navigate the healthcare system can improve your health and help you control your health-related expenses. Let's look at an example of how this knowledge can be put to work in navigating the healthcare system. Jack is 55, has diabetes, and he has been struggling with pain in his right knee. After a long, painful weekend, Jack decides it's time to see a doctor about his knee. Deciding which doctor to see and where to see them is Jack's next challenge. Jack has health care through his employer and knows he will have out-of-pocket expenses for care over and above his monthly health care insurance premium. Jack decides his pain level and situation don't rise to the level of going to his local emergency room or ER. Jack has been to the ER for a previous car accident, and he understands ER care would increase his out-of-pocket expense. Jack decides to start by making an appointment with his primary care physician. Together, they decide Jack should see a local orthopedic specialist about his knee. Over the course of the next 2 months, Jack undergoes knee replacement surgery and begins regular physical therapy. As Jack starts the physical therapy portion of his knee replacement journey, invoices begin to show up. Individual bills show up for the surgeon, his hospital stay, and his physical therapy. Additionally, Jack has been paying for a portion of his prescriptions. As the bills come in, Jack keeps a running total and is alarmed when he realizes that his costs have gone beyond the amount that he thought was average for knee replacements, and he has just started what is supposed to be 8 weeks of physical therapy. After 8 weeks of physical therapy, Jack, his physical therapist, and orthopedic surgeon decide that he should continue physical therapy for another couple of weeks. As a person with diabetes, it is taking a little longer for Jack to heal, so this extra time will ensure he can achieve the post-surgical quality of life that he intended. Having his knee replaced ended up costing a little more than Jack had planned, and he spent more than he had expected, but in the end, his new knee allows him to return to doing things he loves, like hiking. Let's look back at how Jack's knee replacement fits into the healthcare industry and examine different decision points along the way. When Jack decided it was time to seek medical care for his knee pain, he had to make decisions about which doctor to see and where to see him. Should he see his primary care physician, a doctor at his local urgent care, or a doctor at his local ER? In healthcare, this is what is referred to as utilization. Simply put, where and with whom is Jack going to utilize medical services? All 3 of these choices have different associated costs for Jack's insurance company and his own out-of-pocket expense for things like his deductible. Once Jack settled on an orthopedic surgeon, they likely discussed Jack's post-surgery quality of life expectations. In Jack's case, he wanted to be able to go on day hikes with his wife. Adding extra time in physical therapy helped him achieve this goal. These discussions and decisions are related to what in healthcare is called quality of care. Patients like Jack, their caregivers, and providers need to have these conversations to make informed decisions. Finally, all of these choices ultimately impacted Jack's financial costs. Together, utilization, quality, and financial costs form the basic framework of the core mental model behind modern healthcare. Furthering your understanding of how to best navigate the healthcare system can improve your health and help control your costs. To learn more about some of the terminology used in Jack's story, check out our video on becoming fluent in healthcare speak.